Hi, my name is Deandra, and my presentation today is about medical aid in dying. For the purpose of my presentation, I wanted to share my opinion on medical aid in dying. I wanted to share with you what medical aid in dying is and the benefit of patients utilizing it. I would like to explain why other states should approve this benefit for their terminally ill residents. I would like to also explain why hospitals and providers who are in the approved states, why they should be more willing to help their patients. I would also like to define dying with dignity and explain the process of medical. For this proposal, my main audience is going to be the public, my local community legislation, the local medical providers, and some hospitals. Here you can see on the graph where terminally ill diagnosis and what type of diagnosis patients that utilize medical aid in dying. As you can see, lung cancer is one of the big contributors of patients who utilize medical aid in dying. So to talk about the process quickly about medical aid in dying, there are a couple of requirements that must be met before even the process starts. One is that the individual needs to be 18 years or older. You need to be an adult. You must have a terminally illness, and you must be ready to die in the next 6 months or have less to live. Also, your mental status must be okay per doctors before this process starts. It is an application process. You need to meet with your primary care doctor. Here are some personal stories that I have printed out here for you. The first one is Brittany's story. And you might have heard about this. This is the young girl whose story went global, and she helped the laws changed in California for medical aid in dying. Miguel is another story that I printed off, or I presented here, where it really kind of proves my point where, you know, not having medical aid in dying really does just cause suffering. He is from Puerto Rico, and unfortunately he wasn't able to make it to one of the 6 states that were approved here in the United States. So he unfortunately did pass away, and it was a painful death for him. Jennifer is another story that I presented here. She fought for her right to utilize medical aid in dying, but she also did it for other individuals to have the opportunity to die with dignity. So dying with dignity really is, you know, dying when you're ready to, when you've come to that point and you're ready to end your life. You take your medication that is prescribed to you after you go through the medical aid in dying process. Because you have and you are approved for the medication doesn't mean that you have to take it. It gives these individuals peace of mind to utilize the medication when they're ready. So in my conclusion, I would like to let you know that medical aid in dying is not suicide or euthanasia. It gives individuals with terminally ill diseases the opportunity to die with dignity. It gives their family, friends, as well as the patient peace of mind. It's a choice to utilize the medical aid in dying medication. Just because, like I said, you're approved for it doesn't mean that you have to use it. It gives these individuals